All right, everybody, it's 8 o'clock, so we're going to get started with our webinar. Thanks for joining us today for our April Junior Ambassador Briefing. Today, we're going to talk about all of the things that we learned at the Platinum Ambassador Assembly, through our virtual assembly, and, of course, through all of you coming and talking and sharing your ideas, thoughts, and motivation for where this program can go. We're going to be talking about our co-sponsor competition later through this briefing, and we're going to talk about some of our legislative process so that we can really understand how our actions are going to make an impact. To get started, my name is Julie Eller, and I'm the manager of Grassroots Advocacy. If this is your first time joining us, welcome to the Junior Ambassador Program. We're so excited to have you here. And with our program, we're going to do everything in our power to be the voice for kids with arthritis. Today, I want to start with a recap from our Platinum Ambassador Assembly. And I know some of you on the line were actually able to attend the assembly in person, and many of you were able to participate in our virtual assembly. So let's go through some of our results. Our virtual assembly asked our participants to take pictures of themselves holding a sign that says, I #advocate for arthritis because, and then it gave an opportunity for people to share why they were advocates for arthritis. We had an amazing outpouring of support from all across the country, all around the world in our campaign. Here are some of our greatest messages from Twitter. We also had people advocate through other social media groups like Facebook and Instagram. Some of my favorite posts were ones of our maybe not quite yet junior ambassador aged kids who are going to age into the program someday. And especially some of the posts of people with their dogs. We had some really great posts on Facebook as well. And most of all, we had people participating from all around the world. We were able to garner over 11 million impressions online, which meant that we were able to really be able to spread our stories, share the word, and raise awareness for arthritis. So we had over 11 million impressions online, and we encouraged people to connect with their members of Congress, to connect with their potential walk teams, and we were even able to see our presence in Germany and Australia throughout. We were able to raise awareness, amplify our message, and show our communities that we care. So thank you so much for engaging in the virtual campaign. If you were able to be there in person and still were able to share your message online, it really helps to make your message count. If you were able to do so just from the comfort of your own home, it helps to make that introduction to your members of Congress. So give yourself a pat on the back because we really did have a far reach with our assembly campaign, and we were able to make sure that our voices were heard. So yeah, we had presence in Germany and Australia. We had some celebrity engagement. Broadway star Anna Villafante engaged with our campaign. And we know that in the future we'll be able to have an even broader reach. So thank you so much. This is our first time doing a campaign like this, and it's just the beginning. But we also had people in Washington, D.C. engaging with us at the assembly. And our young leaders in Washington really made a difference, and they were some of my favorite and most impactful parts of our event. I was so happy to have all of our junior ambassadors there for many reasons. Some of them were just getting to see them engage online. Some of them were getting to see them engage in person with their members of Congress and each other. And some of it was being able to recognize our scholarship winners, Whitney Greaves, Ethan Berkowitz, Marilee Jewett, Jessica Poff, Brittany Thomas. We were able to really extend a word of thanks to some of our junior ambassadors and think broadly about how we want to change the Junior Ambassador Program and make it more impactful. The junior ambassadors got to meet with their elected officials and their staff in person. They got to try out advocacy for real, in real time, in person, and that's something to really be excited about. But they also were able to provide some amazing feedback for our Junior Ambassador Program. So one of the things that we talked about were different ways that we could create assignments for junior ambassadors that would be really impactful, more ways to engage with their community. We also talked about ways that we could fundraise a little bit differently, ways that we could showcase our stories on social media, and different ways that we could show how we want our lessons in our webinars and briefings. So what did we come up with? Well, in the community engagement space, we realized that we wanted to do more direct engagement with community partners, not just legislators, but also encourage others to share their stories as well. One idea that I thought was particularly good was to build relationships with people at local nursing homes, other people, elderly people who have arthritis, and encourage them to share their stories through a letter writing campaign maybe. We also talked about some new and innovative fundraising ideas that might be able to encourage people to fundraise outside of those traditional Walk to Cure Arthritis or Jingle Bell Run events, like organizing a bake sale at your school, starting a Pura Vida bracelet campaign, or encouraging your school, if you have school uniforms, to have a jean day where kids pay $3 to wear a pair of jeans on a Friday, and then all proceeds, or a portion of the proceeds, go to the Arthritis Foundation. I was also really impressed by people's ideas about how to engage on social media. I really loved some ideas about organizing a day in the life social media campaign where we gather our junior ambassadors together and have them take pictures and video and write stories about what it's like for them to live their day-to-day life with arthritis, to help correct maybe some of those misconceptions that people have about people with arthritis. You know, it's not just a grandparent's disease. Look, I'm a teenager and I experience these symptoms as well, but I also am able to go to school and able to do these things, and trying to transform maybe some of the messaging we have around arthritis so that it's really positive and can showcase all of the joy that comes along with our lives and kind of the resilience of this disease. We talked about more junior ambassador blog posts and maybe even a video campaign where we put some of these ideas together and then create a video for legislators and to raise awareness for arthritis. We also decided that our lesson format in our junior ambassador program, these briefings that we have, maybe need to be coupled with some more written material so that if you miss a webinar, you aren't missing a lot. And you can make it up at an easier time. So we want to really focus on recording our webinars. We want to focus on making them shorter and sweeter, which I don't know that I'll deliver on today, but I'll certainly try. And also coupling them with some written material. So just before this briefing, I sent out an email probably about an hour ago that includes a written guide for our activity for the next 2 months, and talks about what our briefing is going to be today. So I included a PDF of our slides, and after this webinar, I'd love to hear your feedback on if these were effective ahead of time. If you have any suggestions for how we can improve them in the future, I'd love to hear them. One of the other big things that we thought about was a task force that could bubble up these ideas. So we want to create a junior ambassador task force where our task force will meet every month where we don't have a webinar. So we would have a meeting, let's say, next month, and then the following month a webinar, and the month after that we would have a task force meeting. And the task force would be expected to respond to surveys and come up with ideas for the programs, help determine what our lessons should be about, and help to drive our program. So really making sure that your voice is heard and making sure that you are the drivers of this program so that each of our actions is really inspired by one of your ideas and so that it feels as impactful as possible and meets you where you are. If you're interested in joining the task force or learning more about it, it's still in its formative stages. And I'm trying to gauge your interest, so please email me at jeller@arthritis.org after this call. You can just respond to the email that I sent an hour ago and let me know that you're interested. Depending on level of interest, I will be able to determine what our process will be in terms of when we start it up and how we move forward with it. So please keep that in mind and let me know if you're interested. So now I want to shift gears a little bit. We've talked about some of those things that we learned at the Platinum Ambassador Assembly and in the virtual assembly. And now I want to talk to you all about our activity for this month and through the framework of some of the lessons that we learned at the Assembly. So I want to talk about the legislative process, and I want to talk about the Ensuring Children's Access to Specialty Care Act. Now this bill helps to address the pediatric rheumatology shortage that I know most of you are familiar with. But if you're not, we have around 300,000 children who live in the United States with arthritis. Unfortunately, there are less than 350 practicing and board-certified pediatric rheumatologists. Those are the specific kind of doctor that's meant to treat arthritis, right, or pediatric arthritis. And so when you have such a high prevalence and such a low amount of doctors to address that prevalence, it leaves a lot of kids without access to the care that they need. So we try to address that through legislation called the Ensuring Children's Access to Specialty Care Act that helps to encourage people to pursue pediatric rheumatology through a national loan repayment program. So that's the framework that we're going to keep in mind as we talk about our legislative process. And our legislative process is quite easy for all of us. What we want to remember are the 4 Ps of advocacy. We want to know the players, we want to know the process, we want to know the policy, and we want to know the politics. And knowing these 4 Ps allows us to have the cutting edge when it comes to advancing legislation like the Ensuring Children's Access to Specialty Care Act. So let's kind of go through these Ps and learn a little bit more about them within that frame. So we really want to know the players. And if you have been a part of our Junior Ambassador program since the inception, one of your first activities was to become familiar with your federal representatives and senators in your state. We want to be the voice for people with arthritis in our state. So it's important that we know who these important elected officials are. So in your state, as a constituent, you have one representative that's determined by your federal district where you live. And you have 2 senators, which is determined by the state in which you live. These 3 elected officials are your federal members of Congress, and they are who you can connect with when we're talking about federal legislation, like our Ensuring Children's Access to Specialty Care bill. It's important that you know who these folks are, especially as we move forward with our competition for co-sponsors, especially the senators. We're going to be focusing our efforts this month on encouraging more senators to support our bill. So it's important that you know who your senators are in your state. And you can use our Find Your Elected Officials tool through our Action Center to find out who those folks are. So that's the step 1. We want to know who we're talking to, because if we don't know who we're talking to, we can't define our ask in a way that really will be impactful and matter to them. Here's the other piece. We also want to know the players. So we want to know that our members of Congress are supported by a staff of people who can help to hear constituents' concerns and act on them. And we've had a lot of congressional staff that we have worked with either through the Assembly. If you were there, you might have met a congressional staff person in person, or you might communicate with one in some of your letters. I know many of you have received responses to some of the letters that we've sent through our program, and it's likely that the person responding to your letter was either an in-district or Washington, D.C. based congressional staff person who works on healthcare legislation. I want to remind you all, this is really important to me. I want to remind you that congressional staff are always all new. Look at how many years each congressional staff person has been in their current position. And you'll see that 70% have only been there for maybe up to 2 years, from 0 to 2 years. And if that's the case, that's a really important thing to keep in mind, because that means that every time we want to send a message to a congressional staff person or to our member of Congress, we want to remember that they might not have been in that role for very long. So we have to do our best job to introduce the issues to them and introduce why they're important to people with arthritis. That congressional staff person might not know that children get arthritis too. And if they don't, then it's our job to make sure that they do know. So when we think about how a typical congressional office is structured, we know that we have the member of Congress at the top of the pyramid, at the top of the food chain. He or she has a staff that's led by a chief of staff and a deputy chief of staff. And underneath them is the legislative director. And the legislative director charts the course for the type of legislation that the member of Congress, the senator or the representative, might engage in. So they have a team of people, legislative assistants, who are devoted to particular issue areas. Legislative assistants might have a number of issue areas that they're responsible for. And one of those issues will be health care. So legislative assistants are going to be our main point of contact as we're trying to direct our messages. They might have legislative correspondents or staff assistants underneath them to help us respond to our concerns. But we want to remember that this pyramid really will inform our ability to impact. We want to not only know who our senators are and who our representative is, but maybe also some of these people who make up their staff, because the more we know about them and the better our relationships can be with them, the stronger our advocacy can be. So as you're going through and sending your letters or making your voice heard on Capitol Hill and beyond, we want to make sure that we are becoming familiar with the names and the email addresses that we're sending to. The more familiar we can be, the stronger our ask can be, and the better off our advocacy will be in the future. So here's a really important point. The next P. We want to know the process. I really love this slide. Our federal director created these 4 Ps, and especially this slide I think is very funny. But he wants to remind everyone that there's no constitutional limit on the number of times that you can ask your member of Congress and their staff to take action on an issue. So he uses this metaphor of the cross-country road trip. We have this image of, are we there yet, in the back seat, kids screaming. It's not a bad metaphor for talking about the legislative process, because the legislative process is a slow one that requires perseverance and consistent follow-up. Interacting with your legislator and their team, their staff, is like a cross-country road trip, and we want to remind them that we are along with them for every step of the journey. We want to remind them that we're there with them before the bill is in committee, and while it's in committee, and while it's going to markup, and through each step of the process. So remember that there is no constitutional limit on the number of times you can make your ask, and how many people can make that ask along with you. So remember that your message is strengthened when the people around you are sharing that same message and making that same ask. Advocacy is a community activity. It's a team activity. It's a family activity. And we are stronger together. So remember that as you're making these asks, it's best to really rely on the people around you. So here are some do's and don'ts when we're taking action with our legislators. We definitely want to do our homework on the issue and the legislator. That means we want to know the bill and why it's important. We want to know if the legislator is favorable on the issue. What party do they belong to? How long have they been in Congress? We want to be punctual and positive with our messages. If we know that there's a vote coming up, we want to time our message along with it. So that punctual nature is very important. We also want to customize the ask. So we want to focus in on a particular bill. We want to make sure that our messages are really specific to a particular issue. And we want to make sure that the pitch is customized. While we talk about the Senate bill, the Ensuring the Children's Access to Specialty Care Act, we know that some senators have already signed on to support the bill. So if one of those senators is in your state, we want to make sure that we're sending them a message of thanks. We definitely don't want to send them a message that asks them to support something that they already support. It's really important that we make sure that we're thanking the right people and making the ask to the right people as well. Otherwise, it looks like we're not doing our homework, and it looks like we're sloppy as we make this approach. We also want to express our thanks, and we want to ask for contact information for the best person. If you're sending a message through our Action Center, it's really, really important that we ask for the best contact information for the legislative assistant that we can connect with so that we can have a direct line of communication to them in the future. And, of course, we want to follow up. If you haven't heard back from your legislator or their office, their team, don't be nervous to follow up and remind them that you sent them a message however many days or weeks or months ago. Here are some important don'ts when it comes to the process. We definitely don't want to assume that our legislator or their staff is familiar with our issue. Remember that graph from before. Some members of Congress have teams that have been in place for no more than 2 years, 70% of them, in fact. So if our staff is fresh, we have to approach them where they are. So we want to make sure that we're giving them the opportunity to learn from us and use us as those experts in our care and in our policy. If you don't agree with your legislator or their staff, it's important that we're not snarky about it. We don't want to be critical of people's personalities. We want to encourage them to join our cause, and we definitely get more bees with honey. So remember that we want to be really positive as we go through the process. We want to have a focused issue. We want to make sure we're talking about one piece of legislation or one bill so that we can really narrow our ask. We want to keep it focused and clear. Introducing multiple asks at one time can be really distressing. It can cause confusion. So we don't want to introduce that into the equation. And the most important don't of all is don't give up. Our legislative process is like a long road trip. It's important that our voices are heard every step of the way. So don't be afraid to pipe up and make your ask known. Ask multiple times, ask every day, and your persistence and your dedication will be recognized and seen on Capitol Hill and beyond. And the final one is really that we want to know the policy. When we're making our ask, when we're taking action, we want to make sure that that action highlights the problem and showcases some statistics that make our asks compelling. We want to identify a solution, so give members of Congress an opportunity to act. If we're writing them and just complaining, hey, this stinks, like I really am upset about this, but not providing a constructive solution, it doesn't allow our members of Congress to take action. We want to give them the tools to take the action that they need. We also want to make it real for them. And the way we do that is really simple. We just share our stories. We talk about our patient experience, and we bring that into the conversation. Sometimes that's all it takes to humanize the policy for them and make it understandable so that they want to take action. And then the last part of the policy, the last part of your ask is to make the request. We want to be clear about what it is that we want our legislators to do. And so we have all of these P's, we have all of this guidance, and there's one last one we need to talk about. And it's knowing the politics. Awareness of the political environment has to shape your approach. So when we think about our members of Congress, we know that they might belong to different political parties. And we know that some asks will be better received by Republicans and some asks will be better received by Democrats, and independents might be right in the middle. But it's really important that we know as we do our homework what political party that might be so that we can think about what the best way to frame our ask might be. And if you need help, that's what our advocacy team is here for. Just reach out and we can help you frame your ask in a way that's really constructive and hard to ignore, because at the end of the day, arthritis is not something that looks at your party affiliation before it before it becomes a part of your life. Republicans and Democrats and independents and anyone on the political spectrum anywhere can be impacted by arthritis. So we have that, and we can use that to our advantage. But if we can focus in on what those political parties might be, we might have a better opportunity to make our ask strong. So we talked about a lot of P's, and we talked about a lot of process, and now I want to talk to you about our Ensuring Children's Access to Specialty Care bill. We want to make sure that kids have access to the doctors that they need. And so this bill addresses the pediatric subspecialty shortages by allowing providers like pediatric rheumatologists to be eligible for loan repayment. College is expensive. Medical school is even more expensive. And it takes years to become a pediatric rheumatologist. So we want to help people become pediatric or enter into pediatric subspecialty fields. And one way that we can do that is by expanding the amount of people eligible to apply for loan repayment service. So we have a bill, and the bill is S989. It has a companion bill in the House that you may be familiar with. But for our activity this month, we're only going to focus on the Senate version. And the reason is we're going to be doing an activity that will ask you guys to collect signatures from people in your home state. We want to collect as many signatures as possible so that we can make sure that our voices are heard on Capitol Hill. And we're going to be sending those signatures on to our senators in their in-district offices. So we are going to send different messages to our senators based on their status for this bill. This here is the list of people who are currently sponsoring the bill. Senators Roy Blunt and Jack Reed are our primary sponsors, and we have senators from Minnesota and Maine and New York and Rhode Island and Indiana and New Hampshire who are signed on. And if your senator has signed on, then you are going to be able to say thank you with your petition. But if you don't see your senator on this list, or senators on this list, we're going to be asking you to print out petitions that will allow you to go around your community and ask people to sign their name in support of your bill. You can ask your fellow students, you can ask your friends and family, you can ask people on your sports teams or in your plays. Most important thing is that we get people to show their support for our bill. So we're going to have this co-sponsor competition. What we want to do is empower you all to share your stories with the people around you. Talk with your community and engage with them. Tell them why it's important for you to have access to your pediatric rheumatologist. And ask them to help you help others gain that same access. So we have a couple of steps for this competition. The competition will end on May 31st. And on May 31st, we're going to I'm going to collect all of the emails, anybody who's participated in our survey or our petition, and I'll count each junior ambassador's the amount of signatures that they received, that they were able to gather through this program. And if you're able to gather a bunch of signatures, I'll count them up, I'll tally them up, and the person who gets the most signatures will be featured on one of our upcoming advocacy blogs. So we'll talk about our co-sponsor competition, we'll talk about the process, and we'll feature you on this blog post that's coming up. It was really exciting. I talked to a couple junior ambassadors about this program, and we got some really good response. I want to thank especially Emily Mogul, who helped me go through these things and really think about some of the steps and think about whether or not this would be a good activity for all of you. So let's go through our steps for our co-sponsor competition. Step one is to choose your petition. And we have two petitions, one to thank and one to ask for support. So if your senator is already a sponsor of the bill, you'll use one petition to thank them for it. If your other member of Congress is not currently a sponsor of the bill, you'll use the other petition to ask them to sponsor. Step two is to edit the petition. So your petitions are included in the email that I sent about an hour before this presentation. The last 2 pages of the guide have one petition for thanks and one petition for support. You'll want to populate your senator's name into the petition before you print it out. So edit it with their names and choose the best one for your senators. Then you'll print out your petition and get to collecting signatures. I want to really encourage you guys, we're in Walk to Cure Arthritis season. If you're participating at your Walk to Cure Arthritis, that would be a really great time to bring your petition with you and ask to collect signatures. Everyone at that walk will be ready to help you or ready to add their name to your list. After you're done collecting your signatures, remember our due date for our competition is May 31st. I want you to count the names and send me a copy of your petition. That way I can verify them. Then the final step will be to send your petition to your members of Congress in your in-district office. So each senator has offices in your home state. You can find those addresses through our Find Your Elected Officials tool, and you can send your petition to them through snail mail through that process. You can use one petition for both of your senators. Simply populate their names in the Edit Your Petition step, and then when you're ready to send your petitions on, you can make a photocopy of your petition and send one to each senator. So those are the steps for success in our competition. I just want to highlight what our guide to grassroots action looks like. We have an introduction that outlines these steps a little bit more, and then we have, this is only one of our petitions. This is the one that asks senators to support the bill. So you can see you would just populate their names in the Dear field. So you just say, Dear Senator Booker and Senator Menendez, and then if you're in New Jersey, and then you don't have to sign your name at the end because you're sending this from the undersigned. So everybody would print their name in this column and then sign their name in this column. You can print out multiple pages so you can get lots of signatures. You can just try to set a goal of filling one page. All the signatures you can get count and matter and are important. So send them on to your in-district offices in your home state. And if you have questions throughout, I'm available. So send me an email, give me a phone call. I'm happy to talk these things through with you. So with that, I'm going to end my presentation portion of this and pause to see if you have any questions. You can ask your questions live by unmuting your line, hitting #6, or you can ask them in the chat and Q&A feature. For the petition, this is a good question. For the petition, one question I have is, do we need to make sure that we are asking people that are voting age? And my answer to that is no. You can ask people who are your age. You can ask people who are voting age. The most important thing about the Junior Ambassador Program is that it is really empowering people your age, teenagers, to get engaged in advocacy. Your voice matters, so make sure that you are encouraging your friends to sign your petitions as well, because, you know, right now, if you're not registered to vote, you're going to turn 18 very soon, and when you do, we want to be with you then too. So starting that process now, engaging now, will really help you to hone those skills for the future. Are there any other questions? All right, good. Well, thank you, everybody. This will conclude the beginning part of our Junior Ambassador Briefing. I'm going to take a quick break now, and if you're staying on the line for our orientation, we'll get started in just a few moments. Thank you so much.